Another sign of labour could be that your waters break. Waters can break at any point during the birthing process. Some ladies may find that their waters break sort of earlier on in pregnancy and that actually still birth and labour is a way off. But commonly they will break at some point during the birth. For some ladies they may be the first sign of the birth process, so their waters break. For other ladies they might have many hours of contractions and their waters break at some point. Or it is actually possible for the baby to be born inside the bag of waters, what we call an on-call delivery. It's not particularly common and is generally with quite a small baby, but it's quite an amazing thing to experience. I'm going to explain to you the different ways in which your waters can break. So you'll have to excuse my very primitive drawing, but it serves well to demonstrate this point. So we have a baby inside the sac of waters, hopefully head down and into the pelvis. There is a small bag of waters that comes down in front of your baby's head. These are called the forewaters. Baby's head then acts as a little bit of a plug into the pelvis, and the rest of the waters become trapped behind your baby's head. So waters breaking, perhaps how we see portrayed in the movies, tends to be quite dramatic and obvious, like a tsunami of fluid coming away. Very often in real life it's not that dramatic, it's over dramatized for the purpose of the movie. But a lady might kind of feel a pop and then feel a gush of fluid, perhaps a cup form. And if those waters have gone, it's likely to be these forewaters that are in front of your baby's head. However, sometimes we can have a break in the hindwaters behind your baby's head, and this be a little bit less obvious. So typically a lady may go to the toilet to empty her bladder, empties her bladder, and then there's just another little bit of a trickle of fluid that comes away, but that she didn't feel was urine. And then as she stands to wipe, there's just another tiny little trickle of fluid that comes away. And then she perhaps notices that she's having to wear a sanitary pad because she feels a little damper. This is likely to be a break in the hindwaters behind your baby's head. And because the baby's head acts as a plug and the forewaters in front of your baby's head are still intact, this is why it's less obvious. But either way, be it the more obvious forewater break or a break in the hindwaters, your waters breaking is important that we know the time that this has happened. So for example, if you were at home and you were 38 weeks pregnant and you'd had no contractions and you noticed that you are losing some fluid, then give us a ring to Maternity Assessment Centre or Delivery Suite outside of Maternity Assessment Centre opening hours. The midwife will take a little bit of a history from you, and if you tell us, yeah, I was stood and I felt a bit of a pop and there was this clear fluid that sort of gushed away, then it's most likely that your waters have gone. What we would do is, because you weren't experiencing any contractions, we would ask you to come in and we would just have a check to see whether the waters have gone. Have a listen into baby's heart rate, to have a look at your sanitary pad. If the sanitary pad is heavily soaked in fluid, then that's kind of our diagnosis made. We would also do a check of your blood pressure and pulse and temperature. If you were over 37 weeks when you think your waters have gone, and there are no other signs of labour starting, so there's no regular contractions, we would then send you home for a period of around 24 hours, if all is okay, to await the onset of your contractions. If you are less than 37 weeks, we may do something different. But typically, 60% of ladies whose waters break over 37 weeks will start their labour within that next 24 hours. For the 40% of ladies who don't start with regular contractions in that next 24 hours, we would then discuss with you what you wanted to do next. We don't want to wait a prolonged period of time before your baby's birth, because that can significantly increase infection risk for both mum and for baby. So at 24 hours, we would discuss with you the benefits and potential risks of helping the birth process along. Some ladies may decide yeah, I'm just happy to help that process along. Other ladies might actually prefer to wait a little longer. And if all is well with their temperature and their baby's movements and they feel well and there's still some clear water coming away, it is possible to wait a little bit longer. What colours should the waters be? I've already explained that most likely the waters would be clear. Waters that are pink mean that we need to perhaps do a couple of extra checks on baby's well-being, perhaps to pop you on the monitor to monitor your baby's well-being. Waters that are black, brown or green are a sign that your baby has passed meconium. Meconium is your baby's first poo. And if there is meconium in the waters, we would just keep a little bit of a closer eye on your baby's well-being. It is quite common to have passed meconium in the waters if you have gone over your due date or a post-term. If your baby does pass meconium, it will depend on how much meconium there is and what colour as to what we do next. If the meconium is very thin, then we could probably wait for 24 hours before we start the birth process off. If the meconium is very thick or very fresh in colour, we are likely to ask to keep you in hospital so we can assess what's happening. For any baby that has passed meconium before birth, we would then ask to do some observations of your baby's well-being at 1 and 2 hours of age. The baby would stay with you and we would just measure the baby's temperature, heart rate, breathing rate and oxygen saturations. If all is well at 1 and 2 hours, we can stop. If your baby has passed significant meconium, we may then continue these observations every 2 hours until your baby's 12 hours of age. Once the waters have broken, they will keep coming away until your baby's born. So it's important to change your sanitary pad regularly so that you don't have a soggy pad down below. We would also ask you to avoid intercourse and to avoid swimming if you think your waters have gone. It is quite safe to bath, but not to put any additives in the water, so not to put in any oils or any soap into the water. Just plain water is all that's needed.